and you are now watching a video on cortical surface anatomy, more specifically on how to recognize the various cerebral gyri and sulci on cross-sectional imaging studies of the brain. In this presentation, I'm going to start with a short introduction. Then we're going to talk about gross cerebral anatomy and translate that anatomical knowledge to radiological imaging studies. We're going to finish with some practice cases to see if we actually learned anything new. So let's get started. So by way of introduction, I'm now showing you the MRI images. These are T1 weighted images with gadolinium of 3 patients with cystic brain tumors. They look similar, but they are different. Patient 1 had a metastasis, patient 2 a glioblastoma, and patient 3 a supratentorial ependymoma. The exact diagnosis is not so important for this presentation. The tumors look similar, but they are situated in different regions of the brain. If you were to localize tumor 1 in the parietal lobe, tumor 2 in the frontal lobe, tumor 3 in the temporal lobe, you would be correct, but this is a very broad localization, which will not help you or the clinician explain the possible clinical symptoms these patients have or might have, nor will it help you predict potential postoperative complications. Which of these patients is at risk for a postoperative hemiparesis, an aphasia, or another complication or neurological deficit? Exact anatomical knowledge is important, certainly for radiologists, to be able to answer these questions. However, you need to know the gyri and sulci, and you also need to know where the major brain functions are located exactly. That's difficult, but not impossible. It needs a little study, but that's that. But then you need to be able to translate that neuroanatomical knowledge to neuroradiological images. And that's not easy. You might be able to know and name the different sulci and gyra of the brain on a drawing, like the one here above, but that's easy. CT and MRI studies do not provide us with a nice surface overview like we see here on this drawing. They provide us with cross-sectional slices in several directions. The goal of this presentation is that at the end of this presentation, you are able, without much difficulty, to recognize some of the most important functional anatomical regions in the brain, like the precentral gyrus containing the primary motor cortex, the postcentral gyrus containing the primary somatosensory cortex, primary visual and auditory cortices, and the Broca area. And I'll also mention the Wernicke area. But we'll talk about a lot more. These are just the most important ones. Let's get started with a discussion of gross cerebral anatomy before we jump to the radiological images. This is the lateral surface of a brain. Now, the brain is pink, and its surface, which contains the cerebral cortex, the gray matter of the brain, is very uneven and characterized by a very distinctive pattern of folds or bumps, which are known as gyri. And these are separated by grooves, which are known as sulci. This convoluted arrangement of the superficial brain or the brain surface has a reason. This convolution maximizes the surface area of the cerebral cortex, and it does that very efficiently because about 70% of the cerebral cortex is hidden within the depths of these sulci. These gyri and sulci form important anatomical landmarks that will allow us to separate and localize the different functional centers in the brain. Basically, we need to know 3 important sulci to get started. And on the basis of these 3 cerebral sulci, we can divide the brain into 4 lobes. 2 of these sulci can be recognized on the lateral surface, so this surface here, and one is the central sulcus, the other one is the Sylvian fissure. The central sulcus separates the frontal lobe from the parietal lobe, and the Sylvian fissure separates the frontal and parietal lobe from the temporal lobe. Lastly, at the back of the brain, we have the occipital lobe, but in the lateral plane or along the lateral surface, there is no clear sulcal landmark or no clear sulcus separating the occipital lobe from the parietal and temporal lobes. So here, the division is a bit arbitrary, but we have to admit that the division of the brain into 4 lobes, and some anatomists divide it into 5 or even 6 lobes, is a bit arbitrary to begin with. But let's not go into that. Nevertheless, we can attribute certain brain functions to the various lobes. The frontal lobe, for instance, is involved in motor functions. The primary motor cortex is located in the frontal lobe, as well as supplementary motor cortices. The frontal lobe is also very important for certain higher cognitive processes and or personality. The parietal lobe is mainly involved in the reception and the processing of sensory information. It contains the primary somatosensory cortex and higher order association areas to that regard. The temporal lobe is an important lobe for the processing of hearing, memory, and smell. And the occipital lobe is involved in vision and contains the primary visual cortex, as well as some higher order visual areas. Now, if we were to take a peek into the Sylvian fissure by removing the temporal lobe and here parts of the parietal and frontal lobe, we will see a cortical structure located and hidden deeply in the Sylvian fissure. This is the insula, so the isle, sometimes also called the insula of Ryle, after the anatomist who first described it. And some anatomists consider the insula a fifth lobe. Other authors do not consider it a lobe, but they do not consider it part of the frontal, temporal, or parietal lobe. It's just cortex that does not belong to any of these lobes. The function of the insula is less clear. The insula is probably involved in processing of pain and also in the integration of sensory information with emotions. So is it the fifth lobe, yes or no? It's not that important, I believe. It's mainly about anatomy here, not about anatomical nomenclature. On the medial surface, we will find the third sulcus, which is important for the division of the brain in the various brain lobes. And this sulcus is the parieto-occipital sulcus. And the name already says what it does. The parieto-occipital sulcus divides the occipital lobe from the parietal lobe and an extension, the frontal lobe, which does not neighbor the occipital lobe, but there is no clear sulcal landmark that divides the frontal from the parietal lobe on the medial surface of the brain, which is why I mentioned those here as one, frontal and parietal lobes. The temporal lobe does not really play a part along the medial surface. If we really study the brain at the midline, we don't see the temporal lobe. We just see it here a bit more off midline, taking a peek at what's going on. Now, let's examine this again. So we have a parieto-occipital sulcus, which divides the occipital lobe from the parietal lobe. And then, if we want, we can recognize the central sulcus, an extension of the central sulcus. So the central sulcus is for the most part located along the lateral surface of the brain, but a very small extension is visible or can be visible along the medial surface. And we can use that small landmark here to divide the parietal lobe from the frontal lobe. It's not always easy and very clear where the border is between the frontal and the parietal lobe and the medial plane, however. So here I just had to draw a line and say, well, that's the border. So we have the frontal and the parietal lobe. There's another important sulcus that can be recognized in the medial plane and which is definitely a must-know sulcus, and we will encounter it several times during this presentation. And that is, well, this is the parieto-occipital sulcus. That is this sulcus here, which is the cingulate sulcus. And the cingulate sulcus actually divides the frontal and the parietal lobes from a sixth lobe. Now, I have to be careful what I'm saying here. Some authors consider it a sixth lobe, others say that is just part of the frontal and parietal lobe. Whatever, let's consider it a sixth lobe for the sake of this presentation. That is the limbic lobe. And what is the limbic lobe? The limbic lobe is actually a collection of structures located along the midline that are responsible for emotions and memory, and also play an important role in olfaction. So that's the limbic lobe, which can be considered a sixth lobe or can be considered part of the medial frontal lobe and parietal lobe. So let's summarize. We've now been introduced to the lobes of the brain. Classically, we have four lobes, and this is very broad, but motor functions and personality are mainly are located in the frontal lobe. The parietal lobe is responsible for the processing of sensory information. Temporal lobe does that for smell, hearing, and memory, and will also play a role in speech on the dominant side because we have two hemispheres and one is dominant, which means it is involved or responsible for language. And lastly, we have the occipital lobe, which is responsible for the processing of visual information. And then, depending on if you're happy with four lobes or you want to have more lobes in your brain, you can have a fifth lobe, the insula, which is located deep along the lateral surface and is covered by parts of the frontal, parietal, and temporal lobes. And the parts that cover the insula are called the opercula. So we have a frontal operculum, parietal operculum, and temporal operculum. And the insula is, as said, function a bit unclear, but probably plays a role in pain and the integration of sensory information with emotions. Then on the medial side, we have a potential sixth lobe, which is the C-shaped limbic lobe, which includes portions of the frontal and parietal lobe on the midline. But if we were to look a little bit more off midline, medially in the temporal lobe, we will also find parts of the limbic lobe there. And the limbic lobe plays an important role in emotion and memory. So now we have a very broad functional division of the brain based on the division in lobes, but that's, as said, still very, very broad. So the brain contains a lot of gyri and sulci, and on this image, I actually marked those for you. And we are now going to discuss the most important gyri and sulci on the lateral brain surface. I've made a scheme or a drawing for you because that makes it a lot easier. And we're going to start with the most important landmark on the lateral surface, which is the central sulcus. And the central sulcus is basically the border between the parietal lobe and the frontal lobe, as I already said. Anteriorly of the central sulcus, oh, and the second landmark, not to forget the Sylvian fissure, anteriorly of the central sulcus, we find the precentral gyrus, which contains the primary motor cortex. So if you have a lesion here, you will have a contralateral hemiparesis. And posteriorly of the central sulcus, we find the postcentral gyrus, which contains the primary somatosensory cortex. If you have a lesion there, you can expect to have contralateral paresthesias. Now, the precentral gyrus is bordered by the precentral sulcus, and the precentral sulcus separates the precentral gyrus from three other gyri, which can be found on the lateral brain surface. The postcentral sulcus does the same. It divides the postcentral gyrus from the rest of the parietal lobe in the lateral plane or along the lateral surface. Now, let's discuss the remaining gyri in the frontal lobe. On top, we have the superior frontal gyrus, then the middle frontal gyrus, and lastly, the inferior frontal gyrus. And these are separated from one another by two sulci, namely the superior frontal sulcus and the inferior frontal sulcus. Now, this terminology is, I believe, quite easy. We have a three gyri, superior, middle, and inferior, divided by two sulci, a superior and an inferior one. Let's move on to the parietal lobe. We already encountered the post-central gyrus and the post-central sulcus. What do we find posteriorly of the post-central sulcus? On top, we have a lobule. It's not called a gyrus here, but a lobule, the superior parietal lobule, that is divided by a sulcus from an inferior parietal lobule. And this inferior parietal lobule consists of two gyri. The most anterior one, which is a bit horseshoe-shaped and basically sits on top of an extension of the sylvian fissure as the supramarginal gyrus, and then the more posterior one of these two gyri as the angular gyrus, which is a bit perched on top of an extension of the superior temporal sulcus. Now, lastly, the sulcus dividing the superior parietal lobule from the two gyri of the inferior parietal lobule as the intraparietal sulcus. Let's now discuss the temporal lobe. A bit similar to the frontal lobe, we have a superior temporal gyrus, a middle temporal gyrus, and an inferior temporal gyrus. But now, be careful. When it comes to the sulci, we have a superior temporal sulcus and a middle temporal sulcus. The inferior temporal sulcus also exists, but we will encounter that one when we discuss the basal surface of the temporal lobe. Lastly, the occipital lobe. Well, the occipital lobe is a bit difficult. That's to say, there's a lot of variability and it's very hard to recognize distinctive gyri and sulci. There are broadly 3 occipital gyri in the occipital lobe divided by approximately 3 occipital sulci, but as said, not so easy to recognize and with a lot of variability. So this is just a summary for study purposes for my students. I'm not going to summarize this because we already talked about it. If you want a copy of these slides for study purposes, just send me an email. My email address will appear at the end of this presentation. Now, let's discuss the gyral and sulcal anatomy on the medial surface of the brain. This we've already discussed, the distinction of the brain and various lobes in the medial plane based on the two important landmarks, the parieto-occipital sulcus and the cingulate sulcus. The only thing I'm going to add to this image here is this. I've encircled part of the frontal lobe and part of the parietal lobe situated along the very small central sulcus in the medial plane. Why is that? Because we are there watching at the medial extension of the precentral lobe situated anteriorly and the the precentral gyrus rather, and the postcentral gyrus situated posteriorly, which are not anatomically completely divided from one another and on the medial surface and basically form one unit or one structure called the paracentral lobule. And this contains the motor representations on the frontal part or the anterior part of the contralateral leg and the sensory representations of the contralateral leg situated in the parietal part of the paracentral lobule. So does a lot change in the image when we're going to discuss the very specific remaining sulci and gyri that we haven't discussed already? Well, basically not much. So I kept the paracentral lobule because we already know it. Then in the occipital lobe, we only add one sulcus, the calcarine sulcus, sometimes also called the calcarine fissure. And this divides the occipital lobe and the medial plane into gyri. On the inferior part, we have the lingula, and superior of the calcarine sulcus, we have the so-called cuneus. Then let's move on to the parietal lobe. What do we have in the parietal lobe? anteriorly of the parieto-occipital sulcus, there we have the precuneus, and you already saw the cingulate gyrus appear on these images. The cingulate gyrus is the gyrus situated on the midline part of the limbic lobe and situated between the corpus callosum and the cingulate sulcus. Then let's move on to the frontal lobe, which is the only thing we still have to discuss. On the upper part, we have the superior frontal gyrus, and that's right, the same superior frontal gyrus we saw on the lateral surface, because it also extends along the medial plane. Some authors call this in Latin, the gyrus frontalis medialis, but I do not do that, or I prefer not to do that because it's very confusing, because you also have gyrus frontalis medius in Latin. Medius, medialis, it sounds similar, so I just call it the superior frontal gyrus in the medial plane and in the along the lateral surface. And then here we have a group of gyri which I'm going to collectively refer to as the medial basofrontal and prefrontal gyri. You can recognize different gyri over here, but it's not that important for this topic. We just want to know the most important gyri and sulci. And this is then a nice overview for study purposes. I am not going to repeat all this because I've already shown you everything. This is just for study purposes. Now, let's move on to radiological anatomy. So I started with discussing general anatomy because you just have to know your anatomy before you can translate your anatomical knowledge to radiology and recognize these structures on radiological images. Let's start with the medial surface because the medial surface is actually quite easy on images. This is a sagittal T1 weighted image, and we can recognize all the landmarks we saw on an anatomical specimen just as easily. Let's start with our sulcal landmarks. And to my students, I always say, these ones you have to know for the exam. Oh no, I'm starting with the corpus callosum, which we can always nicely see in the mid-sagittal plane. Now let's show you the sulcal landmarks. We have the cingulate sulcus, which runs a bit parallel to the corpus callosum and then extends upwards. And this very small upward extension is also called the marginal branch. And we will encounter the marginal branch later in this presentation again. Then underneath the cingulate sulcus, between the corpus callosum and the cingulate sulcus, we have the cingulate gyrus. Then we have another very important sulcal landmark, the parieto-occipital sulcus. And here we have the calcarine sulcus or the calcarine fissure. The calcarine sulcus divides the occipital lobe in the lingual gyrus and the cuneus. Then we have anteriorly of the cuneus, so before the cuneus, the precuneus of the parietal lobe, situated in front of the cingulate sulcus, more specifically the marginal branch. We have the paracentral lobule, basically the medial extension of the precentral and postcentral gyrus being continuous with one another in the on the medial surface. In front of that, we have the superior frontal gyrus, and here we have a collection of medial, prefrontal, and basofrontal gyri. So basically, exactly the same. We didn't have to break a sweat. If you know your anatomy, you can simply translate it to the images. Well, if you have nice sagittal images, that is. So something went wrong here, obviously, but I'm not going to correct that now. I can edit it out, but I don't think I will. I made magnification of the occipital lobe. And why did I do that? Because one of the things I want you to be able to recognize on imaging studies is the primary visual cortex. I've described two gyri in the occipital lobe on the medial surface, the lingula, and the cuneus, but which one of those contains the primary visual cortex, so the cortex that receives our primary visual information. This is the parieto-occipital sulcus. This is the calcarine sulcus. Now, where is the primary visual cortex? Along the calcarine sulcus. So it's not specifically located in the lingual gyrus or the cuneus. No, it is located in the cortex of both lingual gyrus and cuneus along the calcarine sulcus. Now, the parieto-occipital sulcus and the calcarine sulcus can also be easily recognized in the coronal plane, especially in somewhat elderly patients who have a bit of atrophy, because then the sulci will widen. And the intersection of the parieto-occipital sulcus and the calcarine sulcus, because they intersect, as you can see here. So I'm just going back to this image to show you the intersection. This intersection forms a nice X, the letter X in the coronal plane. This is the parieto-occipital sulcus on both sides, and this is the calcarine sulcus on both sides. And as you can see, we have a configuration shaped like the letter X. So if you want to find your primary visual cortex in the coronal plane, you can do that just as easily. Just look for the letter X. And I think I'm now going to show you the primary visual cortex on a magnification of this coronal image. So here is the parieto-occipital sulcus. Here is the calcarine sulcus on both sides, and then located along the calcarine sulcus, we find once again the primary visual cortex. Now, the medial surface is pretty easy because the medial surface is also pretty straight. The lateral surface isn't. The lateral surface is convex, and because we do cross-sectional imaging, well, you can't in a sagittal plane get a nice overview of the lateral surface the way we had for the structures along the medial surface. You will always get only part of the lateral surface in the sagittal plane. So the sagittal plane is not that interesting to discuss the anatomy of the lateral surface. It's basically easier on axial planes or coronal planes, but you will need some help. So let's start with trying to identify our most important sulcal landmark in the sagittal plane. How do you do that on the lateral surface? How do you do that if you can't do it on sagittal images? How do you do that on axial images? Well, these are T2 weighted images. They're the same image. I used one as a reference point because I'm going to color it in a bit. So you can basically always recognize, so we are pretty high up in the brain. We don't see ventricles, so we're pretty high. And you can basically always recognize a sulcus running from from front to back along the anterior part of the frontal lobe, which is the superior frontal sulcus. And this superior frontal sulcus very often intersects with the precentral sulcus. So there is some variability in the general population, but most of the times you will be able to distinguish an intersection of both these sulci. And if you remember your anatomy, the central sulcus is located posteriorly of the precentral sulcus. So how can you easily identify the central sulcus? Just look for the intersection of the superior frontal sulcus with the precentral sulcus, which will look a bit like the letter L, or an inverted letter L, or in some cases like a letter T. Just so look for the letter L or the letter T on your axial images, and then you will be able to identify without dropping a sweat the central sulcus. And if you know where the central sulcus is and you know your anatomy, you can figure out all the rest on your own. Then you will know, okay, so just some text here. So look for the letter T or the letter L, and then you know the central sulcus, and then you can figure out all the rest on your own. So let's try to recognize the remaining sulci and the different gyri in the axial plane. So the superior frontal sulcus separates the superior frontal gyrus from the middle frontal gyrus. So by knowing that this is the superior frontal sulcus, we have identified the superior and middle frontal gyri. Because we know where the central sulcus is, we can easily recognize the precentral gyrus, which is located in front of the central sulcus, and as a consequence, also the postcentral gyrus located posteriorly of the central sulcus. Dan, my drawing is not completely correct because, well, this is basically the medial surface of the left hemisphere. So this is the paracentral lobule, where the postcentral and precentral gyrus are continuous with one another and form one functional lobule. Then we have the post-central sulcus behind the post-central gyrus. And you remember from our anatomy lesson at the beginning of this presentation that this then has to be the superior parietal lobule. This is the precuneus because it's located along the medial surface. And then we have the intraparietal sulcus, which divides the superior parietal lobule from the inferior parietal lobule, of which we can only see a very minute part on this image. So we started with be able to recognize the letter L or the letter T, and consequently, we were able to identify all sulci and gyri on this image. So that is why anatomical knowledge is important. You don't have to learn this by looking at images and just saying, well, this is superior frontal gyri, middle front. There is too much variability. Know your anatomy, know some basic landmarks, and you can figure everything out on your own. And that's why I like anatomy so much. This is another example. I've already drawn the letter L, and I'm probably going to teach you another trick. There are a lot of tricks to identify the precentral gyrus or the central sulcus. I am just going to show you the ones I use the most and I believe are the most convenient because some of those are more academical and not very practical. So this is the letter L. So then we know that this must be the central sulcus, this must be the precentral gyrus. And what do we see on the precentral gyrus on both sides? It already appeared in red. We see that the precentral gyrus contains a bit of a knob located posteriorly. And this is the so-called hand knob because this area contains the motor representations for the contralateral arm and, well, the hand and the arm. Information is low as organized somatotopically in both the pre and post central gyrus. So I've already told you that the information for the leg is located on the medial surface. Now you know that the information for the arm and hand is located here, a bit more laterally in this knob-shaped extension on the precentral gyrus, and then the face will be more lower, more inferior and more laterally along the precentral gyrus. So this knob is often visible and can be used as a way of identifying the precentral gyrus. So this is sometimes also called the inverted omega because it looks like an inverted Greek letter omega, but there is also some variability in the shape of the knob. Sometimes it looks like an epsilon, so then you have two knobs, and one side can be smaller, so it can be an asymmetrical epsilon. So here the medial knob is smaller than the lateral knob. Here we see a symmetrical epsilon. We see two knobs of the same size. And here we see once again an asymmetrical epsilon with a smaller lateral knob. And then this is a minority of cases, we see no knob whatsoever. So a patient with no hand knob. That doesn't mean he doesn't have motor representations of the hand or arm, but it's not located in a knob like in these patients. So this is a second trick, and I often combine it with the T or L sign, which I find basically the easiest. So obviously something went wrong when making this slide, but never mind. As doctors, we are used to improvise. So this is once again an image, sagittal T1 weighted image of the medial brain surface. So here is the cingulate sulcus, and we're now going to use the cingulate sulcus to identify the central sulcus. We can do that in the sagittal plane, but I don't find it very useful. So I'm just going to mention it, but it's much easier in the axial plane if you ask me. So this is the cingulate sulcus. Remember that the paracentral lobule is situated in front of the cingulate sulcus. So this is the paracentral lobule. And here it's already marked. We will find the central sulcus. So the central sulcus is situated immediately anteriorly of the marginal branch of the cingulate sulcus. So if you want to identify the central sulcus in the sagittal plane, look for the marginal branch. So the upward extension of the cingulate sulcus, and the central sulcus will be in the sagittal plane, a very small sulcus immediately in front of it. And I even made a magnification. Here we have the marginal branch of the cingulate sulcus, the central sulcus, and this is also described in the literature, but I find it very impractical and not useful at all. This is the so-called sigmoid sign or sigmoid hook sign or a hook sign or whatever. It's basically or should be a correlate for the hand knob and the sagittal plane. So the precentral component of the paracentral lobule often has somewhat of a hook on its back, which is supposed, well, that's not really the paracentral lobule then. This is then the precentral gyrus, this is the postcentral, and this hook is supposed to represent the hand knob. Well, I don't find it very useful. I find it very difficult. It's very subjective, so don't use it. You can, however, use the marginal branch of the cingulate sulcus in the axial plane, and I'm now going to show you how. So the marginal branch of the cingulate sulcus is often visible on axial images and forms a so-called pars bracket sign. It looks a bit like a pars bracket or a mustache, if you want. I always see more of a mustache than a pars bracket with its contralateral brother or sister. And I've shown you then the sagittal plane, the central sulcus is located immediately or is the first sulcus in front of the marginal branch. So if you can identify this pars bracket or this mustache, then you have also found the central sulcus, which is the sulcus in front of it. And to confirm it, let's see if we can find a hand knob. Yeah, we have an omega hand knob of this sign, and here we have an asymmetrical epsilon hand knob. So we are dead sure that this is the central sulcus and this is the precentral gyrus. So the pars bracket sign combined with the T sign or L sign and the hand knob is sometimes useful. As I said, I'm mostly use the L sign or T sign and combine it with a hand knob, and then I'm pretty convinced I found my precentral gyrus. So let's summarize. We've seen the T sign and the L sign as a way of identifying the central sulcus. We've seen the pars bracket sign. We've seen the hand knob, and then we get kind of a smiley face on axial images. And now that we found, without much difficulty, the central sulcus, but also the superior frontal sulcus and precentral sulcus, which are part of the L or the T, and the marginal branch of the cingulate sulcus, we can fill in all the rest. Then this must be the postcentral sulcus. This, of course, is the precentral gyrus and postcentral gyrus located along the central sulcus. Anteriorly, we have the superior and middle frontal gyrus. And the only mistake I made here, or well, mistake, not really correct, is this is the paracentral lobule. So, of course, the paracentral lobule is basically the continuation of the pre and postcentral gyrus, as you know by now. Okay, so now you're able to recognize the central sulcus on axial images, even sagittal images if you really must, and you can discover the precentral gyrus, the primary motor cortex, the postcentral gyrus, the primary somatosensory cortex. We've already seen the primary visual cortex, so we've already discovered a lot of our must-know structures on imaging. What is missing? Well, I also want you to be able to recognize the Broca area. The Broca area is the motor speech center of the brain. Well, when it comes to language and the brain, the story is probably a bit more complex, but let's just keep it easy for now. And let's just say that a speech output, language output is generated in the Broca area, and the anatomical Broca area is situated somewhere in the frontal lobe. Where exactly? In the inferior frontal gyrus. So we have to be able to identify the inferior frontal gyrus, and that's easiest in the sagittal plane. But I'm running ahead of myself. Let's look at these images and try to find one of our easy to recognize anatomical landmarks, and that would be the Sylvian fissure. The Sylvian fissure separating the frontal and parietal lobe from the temporal lobe. The Sylvian fissure has some branches or extensions. We have an anterior branch, an ascending branch, which goes upward, and this one goes to the front, so anterior branch and upward branch. And then we have two posterior branches. We have a posterior ascending branch and a posterior descending branch. These branches are not that important. I'm just showing you those because recognizing these branches will help you recognize some anatomical structures. More specifically, the inferior frontal gyrus, which is situated along the anterior and the ascending branch. And because of that, it has a bit of a configuration that looks like the letter M. So look for the letter M on sagittal images, and you have to scroll a bit laterally to be able to see it because this is located along the lateral surface. Then, by knowing our anatomy, we have now found the inferior frontal gyrus. We know that the middle frontal gyrus must be on top of it. We also know that the sulcus dividing those is the inferior frontal sulcus. And here we must find self-evidently the precentral sulcus. If this is the precentral sulcus, this must be the precentral gyrus. This is the central sulcus, and this is the postcentral gyrus. I'm just filling this in based on my knowledge of anatomy. So you just have to know some landmarks, and you're able to fill in the rest if you know your anatomy. Then, just like we saw in the on the medial surface of the brain, the pre- and post-central gyrus on the lateral surface inferiorly or continuous with one another. So the central sulcus does not divide the pre- and post-central gyrus along their entire extent. So basically, the pre- and post-central gyrus are continuous with one another, both in the medial plane or along the medial surface and inferiorly along the lateral surface. And this is called the subcentral gyrus. So the place where the pre- and post-central gyrus basically unite with one another anatomically. So what else can I tell you about this perisylvian anatomy? So the anatomy of the gyri and sulci along the Sylvian fissure. This is the post-central sulcus, posteriorly of the post-central gyrus. The supramarginal gyrus is part of the inferior parietal lobule, has a horseshoe shape, and is typically located on top of the posterior branches of the Sylvian fissure. So just look at the most posterior extension of the Sylvian fissure, and the gyrus on top of it and along it will be the supramarginal gyrus. And then the angular gyrus has to be situated posteriorly of the supramarginal gyrus, and the angular gyrus does something similarly. It sits on top of the superior temporal sulcus, which I've drawn here for you. And then this has to be the superior temporal gyrus. So now we've recognized a lot of gyri and sulci in the sagittal plane as well. So let's talk a bit more about the Broca area. So the Broca area is situated in the inferior frontal gyrus, and the inferior frontal gyrus often has the shape of the letter M on sagittal images. So it's pretty easy to find, although there can be some variability. So, and sometimes you have to use your imagination a little bit. Let's magnify the region of the inferior frontal gyrus. So this M shape is the consequence of the presence of these extensions of the sylvian fissure, namely the anterior branch and the ascending branch. Then we have the M-shaped inferior frontal gyrus along these two sylvian fissure branches. And where is the Broca area located exactly? Well, basically, the inferior frontal gyrus is composed of three components. The most anterior one is the orbital part because it's closest to the orbits. Then we have the triangular part, which makes sense if you look at the shape of it. And this is the part between the anterior and ascending branches. And then we have the opercular part because it's closest to the frontal operculum. And the Broca area is supposedly situated in the triangular and opercular part of the inferior frontal gyrus. Now, I have to nuance that a little bit because this was basically based on the first description by Pierre-Paul Broca, which was in the 1860s. And a lot of studies have been done on the functional anatomy of language, and the story is probably a bit more complicated, but just for historical sake. And this area truly has something to do with speech, but it's probably more complicated. And this is the motor speech center, as I'm telling you here. So just keep it in mind. Story is probably more complicated, but it works. So just another example, because this is a very nice letter M, you have to admit, look at it. And let's find the different components here as well for practice. This is the orbital part, this is the triangular part, and this is the opercular part of the inferior frontal gyrus. And the triangular and opercular part are, as said, the anatomical Broca area. Now, we've talked a lot about anatomy of the frontal lobe and parietal lobe, but not yet temporal lobe. Temporal lobe anatomy is best evaluated and best recognizable in the coronal plane. So here is a coronal T2-weighted image. Let's magnify it a little bit in a minute. The temporal lobe has two surfaces. It has a lateral surface, and I already told you what sulci and gyra we can find there, but it has also a basal surface. Now, this is new, didn't tell you anything yet, because I didn't want, well, I thought I'd just mention those structures while I'm showing you the radiological images. And I will do that now. So let's get started. Let's magnify the temporal lobe. What do we have? We have a superior temporal gyrus, a middle temporal gyrus, and an inferior temporal gyrus. And these you remember from when we discussed anatomy. And these are new. We have two basal gyri in the temporal lobe, and these run all the way to the back. So they're also part of the basal surface of the occipital lobe. And what are those? We have the lateral occipitotemporal gyrus, and we have the medial occipitotemporal gyrus, which is also called the parahippocampal gyrus. And basically, I called it medial occipitotemporal gyrus here because it makes it easy, but I would call it the parahippocampal gyrus and the temporal lobe. And situated on top of that is the hippocampus. Now, let's discuss sulcal anatomy. This you already know. This is the superior temporal sulcus, the middle temporal sulcus. When discussing anatomy, I told you this will be the middle temporal sulcus, not the inferior one. And here is the inferior temporal sulcus situated along the basal surface of the temporal lobe. Then I'm just going to introduce one new sulcus, the sulcus between the lateral occipitotemporal gyrus, which is sometimes also called the fusiform gyrus, and the parahippocampal gyrus, and that is the collateral sulcus. So that's it for the temporal lobe. There's one peculiar structure which I definitely want to show you in the temporal lobe, and that is the primary auditory cortex. And the primary auditory cortex can easily be recognized, especially in the coronal plane, because it's basically a very small gyrus. Sometimes you have two, even three are possible, but majority have one. It's a small gyrus situated on top of the superior temporal gyrus, and in the coronal plane, it looks a bit like a knob. And this is Heschel's gyrus, which contains the primary auditory cortex. And we have, well, self-evidently, a Hessel gyrus on both sides. Now, the Hessel gyrus is here easily recognizable in the coronal plane. Just look for a knob that looks a bit like a mushroom on coronal images, but you can also see it in axial planes, especially if your images are perfectly symmetric at the level of the thalami, often at the level of the adhesio-interthalamic or the interthalamic adhesion. Then you can see these gyri running uh, to anterolaterally, and these correspond to the Hessel's gyri located on top of the superior temporal gyrus. The Hessel gyrus is also very easily recognizable in the sagittal plane. This is the magnification, and we see once again the gyrus, which has a knob-like configuration, and the sagittal plane looking a bit like a mushroom. Or, oh yeah, and then there's another question. I already told you where Broca area is, the anatomical Broca area. Where's Wernicke area? So Wernicke area is supposedly the receptive speech center, and the part of the brain that basically translates noise into meaningful speech. Yeah, so that we are able to contribute a meaning to it. Where is that? Well, that's a bit difficult. It's even more vague than the Broca area. The classical description by Carl Wernicke, which was in the 1880s, is that the Wernicke area is located in the superior surface of the superior temporal gyrus immediately behind Hessel's gyrus, which would make sense. But a lot of studies have been performed, and it's probably roughly somewhere in this association area or transition area between the parietal and the temporal lobes. So somewhere over here, probably. Then the Heschel gyrus can look a bit like a mushroom, but, and this is an analogy provided to me by Professor Stefan Soenaert from the University Hospital of Leuven in Belgium. And I found it very appropriate in times where Oppenheimer is a hitbox or as a real hit in the theaters at the moment. It can also look like an A-bomb cloud if you use your imagination a bit. So to identify Hessel gyrus, look for a mushroom or an A-bomb on the surface of the superior temporal gyrus. So I'm almost through most of the most important soci and gyri. I briefly touched upon the basal surface of the temporal lobes. I didn't talk a lot about basal surface anatomy. Why? Because these structures are not so easily to recognize on imaging studies and are not always that relevant from a functional point of view. So there was no point in going in detail into it. So I'm going to mention the most important gyri on the basal surface of the frontal lobe for completeness sake, and the ones that are most easy to recognize. So this is a coronal image, and this is a magnified axial image centered here over this region, or the straight gyrus, or the gyrus rectus in Latin, which is located medially along the basal surface of the frontal lobe. Next to it, we have the medial orbital gyrus, and then we have some other orbital gyri, which are more difficult to recognize. We have a lateral orbital gyrus, an anterior orbital gyrus, a posterior orbital gyrus. But if you just call them the orbital gyri, that suffices. And why are they called orbital gyri? Well, they're located above the orbit. That's why. The sulcus dividing the straight gyrus from the medial orbital gyrus is the olfactory sulcus. And why is that? Because in the depth of the frontobasis, we find the olfactory bulb. This is a typical location for cerebral contusions. So always carefully examine the frontobasal area in patients following traffic accidents, for instance. We can also recognize some of these gyri in the axial plane. Here we have the straight gyrus, and we also appreciate where the name comes from. And then lateral of it, we have the medial orbital gyrus, and they are separated by an olfactory sulcus. So, oh, I have one more region to discuss, and then I think we discussed it once again for completeness sake. The fifth lobe, or insula, is a bit hidden, both anatomically and in this presentation, mentioned only completely at the end. Well, I don't think anyone has any difficulties recognizing or identifying the insula on images, both on coronal images and on axial images. The insula is shielded or hidden by the operculum or the opercula of the frontal and parietal lobes and of the temporal lobe. So the operculum is basically the part that hides the insula and the depths of the sylvian fissure. We can also recognize the operculum, and in this case, the frontoparietal operculum on the axial plane. And this here, this sulcus is called the insular sulcus or the peri-insular sulcus, and it's connected to the sylvian fissure. So we can even distinguish if we do some, if we really try the different gyri of the insula, but it's sometimes difficult and it's not very relevant. I made a magnification. This is a sagittal P1 weighted image. I already indicated the insular sulcus or the peri-insular sulcus. And if you look at the magnified image, we can see that the insula has three anterior gyri, which are called the short gyri or the short insular gyri, and these are located anteriorly. And then we have two long gyri at the back. So that's it. So now we've covered most cortical surface anatomy, at least the most important structures and the functionally most important structures. Let's now practice a bit. I'm going to show you some cases, pretty self-evident cases, to put theory into practice. This is a 65-year-old man who has a progressive weakness of the left hand or arm since a week. And what do we see? Flare image, diffusion weighted image. We see an abnormality situated here. Where is that exactly? Well, let's look for our L sign. Here it is. Then this has to be the central sulcus located posteriorly of it. And this has to be an epsilon shaped hand knob. So we are looking at an infarction located in the left, or rather the right hand knob. So this is another patient. This is a 60-year-old male who had an acute paresis of the right leg. And we see a small flare hyperintense lesion with associated diffusion restriction. Where is it located exactly? Well, let's take one slice lower because it will allow us to identify our anatomical landmarks a bit easier. Here we have our L, so this has to be the central sulcus. This has to be a hand knob. This has to be the precentral gyrus, and this self-evidently the paracentral lobule. So precentral gyrus, paracentral lobule. In conclusion, we have an infarction in the left paracentral lobule, which contains the motor representations of the contralateral leg, and we found an explanation for a paresis of the right leg in this patient. This is a 25-year-old female patient who has a hemorrhagic cavernoma in the left temporal lobe. Can we be a bit more specific? Well, probably not on the axial images, but let's take a look at the sagittal images. Here we see the hemorrhagic cavernoma, which is nicely T1 hyperintense due to the presence of methemoglobin. This is the sylvian fissure. Then this has to be the superior temporal gyrus of the temporal lobe. This has to be the superior temporal sulcus. And in conclusion, the hemorrhagic cavernoma is located in the right middle temporal gyrus. Another case contributed by Professor Omid Nico-Paschmann of the University Hospital in Aachen-La-Chapelle in Germany. What to expect in this patient? It's a meningeal metastasis with parenchymal invasion. Can you do a safe surgical resection? What to expect following resection? To do that or to answer that question, we have to know anatomy and we have to know functional anatomy. Let's get started. Here we have the superior frontal sulcus, which forms an intersection with the precentral sulcus. Then self-evidently, this has to be the central sulcus, and this is the postcentral sulcus. we've become pretty good at this, would you say? So then this is the intraparietal sulcus, which often transects the postcentral sulcus. Now we can recognize the various gyri. Sulcal anatomy is very self-evident. This is the superior frontal gyrus located medially of the superior frontal sulcus. So part of the lesion is in the superior frontal gyrus. So that's good. It contains supplementary motor areas, but no primary motor cortex. But then here we have the paracentral lobule. And part of the lesion, or like half of the lesion, is located in the paracentral lobule. It's also partially located in the postcentral gyrus, if we compare to the other side, but the motor hand not as spared. So to answer the question of the neurosurgeon, what do we expect after a surgical resection? We expect basically a paresis of the right leg, because this is the motor or the sensory motor area of the right leg. Yeah. Then the final case of the day. This is a 81-year-old female patient with an acute motor aphasia. And what do we see? The patient received a perfusion CT, and we see hypoperfusion with an increased mean transit time and a decreased cerebral blood flow on perfusion images. Cerebral blood volume is also a bit lower, so this could already be infarcted brain tissue, despite the fact that the unenhanced CT images were negative in the patient. So we see an infarction in the frontal lobe. This is the area of the frontal operculum. And does that answer our question? Is it located in the Broca area? Probably, yeah, if you look at these images, but we really want to see or confirm this, of course. Let's look at axial images. This is a CT performed a couple of days later. So here we see an infarction in the frontal operculum, which is still a bit broad and descriptive. Where is the infarction located exactly? Let's correlate with sagittal images. Here we see the M-shaped inferior frontal gyrus, and we see that the infarction at least involves the opercular part of the inferior frontal gyrus. So Broca area is definitely involved in the infarction. If you remember the slices on perisylvian cortical anatomy, then you know or remember that this has to be the precentral sulcus and is the central sulcus. So the infarction definitely also involves part of the precentral gyrus and the subcentral gyrus, which is the inferior most part of the precentral gyrus. So another case solved. Key messages, well, it's hard to find key messages because I just shown you a lot of illustrated anatomy. I think the most important thing is memorize this, know your anatomy. So, and this is just a scheme, so it's impossible to translate that drawing to anatomical images. But if you know your anatomy, and then you just know a couple of very important and easily recognizable landmarks, and you are able to identify those, you can figure out all the rest on your own, provided you know anatomy. So be able to recognize the central sulcus, and you can basically discover every sulcus and gyrus in the axial plane, and also know your parieto-occipital and calcarine sulcus and your cingulate sulcus self-evidently. And most of all, practice, practice, practice. Just do it on every CT and MRI of the brain you get. Try to localize your lesions as good as you can. And after a while, you won't even have to think about it. If you open an examination, you will also automatically recognize if a lesion is located in the precentral gyrus or not. And if you doubt, well, you have all these tricks to figure it out. So that was it for me. Thank you very much for watching. And if you have any questions, remarks, feedback, whatever, If you want a copy of these slides, just send me an email at neuroradiology.online@gmail.com or leave a comment in the comment section.